My name's Tim Trevail. I'm a Programme Director, PhD candidate, private practice clinician and educator. I run a series of blogs and podcasts which help students and early career researchers and clinicians to understand the research and to provide better value musculoskeletal healthcare. So not everyone's sure what myotherapy is when they first hear the term, but myotherapy is the evidence-based assessment, treatment and rehabilitation of musculoskeletal pain. It really is a fantastic profession where you get to work with a diverse array of people and experience a range of different healthcare settings. So ever since I was a child, I've always had a passion for healthcare and always tried to understand how the human body works. I was fortunate to complete my honours degree in the UK, and then I went back to that university to teach. From there, I developed a passion for education and then started to really combine that with my private practice work and education to build up some good experience, which then led me to Australia a few years later. In Australia, I was fortunate to be offered a role at Torrens University in Think Education as a Programme Director. And on the side, I continued my private practice clinical work. I built up my Masters in Sports and Exercise Medicine, completed that, and then went on to start my PhD, where I'm investigating some physical activity and persistent pain. I love working as a myotherapist for so many reasons. One of those is the goal setting that we get to do with our patients. So we'll sit down at the start of a consultation and we'll set goals. They might be physical, there could be certain sporting achievements that they want to get to, or it could just be returning to the activities that they love doing with their family. I always think people excel when they're combining their passions in different areas and to have an expertise in musculoskeletal health. And for me personally, I have an expertise with a sporting background in jiu-jitsu and combat sports. And clinically, I'm getting to merge those worlds now. So I'm building my own brand and profile in that area and as a specialist in combat sports. And most of the patients I see now, I get to work actively and supporting those people to spend more time doing the sports they love. And I get to spend time with them clinically, working and progressing through active management and rehabilitation plans to keep them on the mats for longer. So the future of myotherapy is bright. We've got a genuine opportunity to shape the experiences of people in Australia seeking musculoskeletal healthcare. The pandemic has made us work differently. I think the patient-driven demand for myotherapy has made us innovate, it's made us think differently, and it's made us use technologies such as telehealth to work out how we can continue our patient care during some of the more challenging times. So I'm really excited for the future of myotherapy, and I think we've got a genuine place in the Australian health landscape to make a big difference for people in our communities.